So if we start with the anatomy here, if we follow the inferior rami here along to the posterior rami of the mandible, if we just move anterior superior here, we've got stomach 6, and this is in the posterior inferior aspect of masseter. If we move forward to the anterior border masseter, we've got stomach 5 there. If we then come across to the edge of the mouth and we just go adjacent to the edge of the mouth here, we've got stomach 4. Now these are all going to fall in the same pathway along the mandibular sort of line. We can also then follow this line up just inferior to the zygomatic arch here, so we'll be just anterior to the condyle, and we'll just be posterior to the coronoid of the mandible, and this will be stomach 7. And then we can follow along the maxillary line here and just go underneath the eye, follow the line down until we drop off here. We'll be on the anterior aspect of the masseter, will be inferior to the zygomatic arch. We can angle that needle back slightly, that'll be small intestine 18. If we follow this line across and we take a line from the centre of the eye down and across from the inferior aspect of the nose here, this will be stomach 3. So this will be our maxillary line along here. We can also come on back to be just adjacent to the tragus here, and this will be small intestine 19. If we go just above the zygomatic arch here, we can have just above the tragus and just above the zygomatic arch, which will be triple energizer 21. We can come just above this stomach 7 point here, this will be gallbladder 3. We can move over just lateral to the lateral aspect of the orbit here, and this will be Tai Yang. If we go superior to the outer canthus of the eye, just on the outer edge of the eyebrow here, we will be triple energizer 23. If we go halfway along the eyebrow here, this is going to be Yu Yao, and if we go just superior to the eyebrow here, this will be bladder 2. Anything where we're at bone, what we want to do is thread the needle so we're going obliquely across the bone, so we're not going directly in. So all of these can be threaded obliquely across the bone. This can go straight in. We can go perpendicular here, or all of these can be perpendicular as well. But when we're at the upper aspect here of the frontal bone, we want to take these needles oblique. So this is going to give us the mandibular, the maxillary, and the ophthalmic branches of the trigeminal nerve. We'll also take in the facial nerve here as well.